As a doctor, there is one complaint I hear every day, repeated over and over again by my elderly patients. It's not back pain, it's not knee pain, it's phlegm. Do you recognize that feeling? It's that sticky, persistent feeling right behind your throat, like an uninvited visitor, that forces you to constantly clear your throat and spit, interrupts important conversations, and worst of all, causes unnecessary embarrassment in public. Let's be honest. Do you start each morning with a series of coughs, producing phlegm, trying to clear your throat just so you can breathe normally? Do you feel like no matter how hard you cough, there's still something stuck there, stubborn and not moving? Maybe you've tried everything: expensive syrups, throat lozenges, all kinds of home remedies. And if you're lucky, you improve a little, but after a few hours it comes back again. Many patients come into my office with a resigned expression, sigh, and say, "Doctor, I guess getting old is just how it is." But today I'm here to tell you a completely different truth, and I say it with the absolute certainty of medicine. That's not normal for old age. It's a lie you've accepted for far too long. That persistent buildup of phlegm, that constant need to clear your throat, it all has a root cause that conventional medicine often overlooks. And you know what's most surprising? That cause isn't always in your lungs. In today's video, I'm not going to give you a temporary fix. I'm going to give you a roadmap, a clear and practical action plan to solve the problem at its root. My goal is to help you regain that feeling of a clear, clean throat so you can speak, laugh, and live without the constant worry of those embarrassing coughs. I'm Dr. Luis Romero, and I've dedicated over 20 years of my life to helping older adults regain control of their health. My mission is to equip you with the right knowledge so you can become your own best doctor. Before we delve into the solution, I invite you to hit the subscribe button to the channel right now so you don't miss any life-saving knowledge. And tell me in the comments what city or country you're watching this video from. I love feeling connected to our worldwide community. Now let's start freeing your throat of that pesky phlegm. Before we get rid of phlegm, we need to understand what it is. Change your mindset for a moment. Don't see phlegm as an enemy. See it as a messenger desperate to tell you something. In reality, that sticky substance you hate so much is a marvelous biological defense system. Imagine your airways as a fragile wall. To protect it, your body coats it with a thin layer called mucus. This layer works like flypaper. Every breath you inhale brings in dust, pollen, viruses, and bacteria. Mucus's mission is to trap these invaders before they can attack your lungs. But how does it clear all that junk? Nature has designed an incredible system. Your throat has been equipped with millions of tiny workers called cilia. They're like little brooms that tirelessly sweep that dirty mucus up toward your throat day and night. When it gets there, you swallow it, and stomach acid destroys it all. It's a perfect recycling process that, in our normal circumstances, you don't even notice is happening. So where does the disaster begin? The problem arises when this delicate balance is broken. Imagine your trachea as a highway. If there are too many cars mucosaur, if the cars are moving too slowly and are heavy, meaning the mucus is too thick, what happens? A traffic jam? That traffic jam is precisely the trapped phlegm you're feeling. Your coughing fits are nothing more than your body's desperate attempt to clear that traffic. And here's the truth about aging you need to know, not to resign yourself to it, but to correct it. As you age, the mucus in your throat becomes drier, the cilia sweep more. Slowly, and most importantly, your thirst sensation is tricked. Older people tend to drink less water because they don't feel thirsty. This leads to chronic mild dehydration, which turns that loose mucus into a thick, cement-like glue. So listen to me carefully. Persistent phlegm isn't a death sentence from aging. It's an SOS signal showing that your body is out of balance. It could be a lack of water, a lack of moisture, or some other irritant. Our goal today isn't to turn off the mucus-producing function, but to restore its natural flow. Now let's get to the heart of the matter. We're going to unmask 5 hidden causes that make this messenger turn into an enemy. Pay close attention because I'm sure you'll see yourself reflected in one of the following causes. We'll start with the number 1 culprit. I call it the master of camouflage. In medicine, we know it as laryngopharyngeal reflux LPR, but remember the simpler name, silent reflux. Why silent? Because when you hear reflux, you immediately think of that burning sensation in your chest, right? But this enemy is much more cunning. It doesn't burn your chest, it attacks your throat directly. Imagine this. Between your stomach and esophagus, there's a door. Over the years, that door loosens. In silent reflux, what escapes isn't a river of liquid lava, but acidic vapor, like a toxic fog carrying the digestive enzyme pepsin. That fog rises and clings to the extremely sensitive tissues of your larynx and throat. Your throat panics because it's not designed to withstand acid. What's its only survival reaction? To coat itself with a thick layer of mortar? That's exactly the thick, persistent phlegm you try to expel every day. It's not a lung disease. It's the shield your throat creates to avoid being corroded by the acid. I remember my patient, Mr. Antonio, 76, very well. Antonio came to me after a whole year of suffering from a hoarse voice every morning and the constant habit of clearing his throat. Previous doctors just shook their heads and said, "It's just old age." But Antonio didn't have heartburn, and he didn't have a stomach ache. However, when I put the pieces together, morning hoarseness, a lump in the throat, and a dry cough at bedtime, the culprit was revealed. Silent reflux. We didn't use antibiotics. We treated the stomach, changed meal times, and elevated the pillow while sleeping. The result was that, in just a few weeks, that ever-present phlegm disappeared as if it had never existed. His voice was clear again. So how do you know if you're a victim of this? Check for these signs. You need to clear your throat constantly as an unconscious habit. Your voice is hoarse, or you lose your voice in the morning. You feel discomfort as if there's a bone or a pill stuck in your throat. You may also feel a bloated sensation and have a sour or bitter taste in your mouth upon waking. If you're nodding along with these signs, it's very likely that the enemy isn't in your lungs, it's evaporating from your stomach. Let's continue the journey to identify the culprit. If reflux isn't your problem, let's look at enemy number 2. Cause number 2, the echo of the past, bronchitis and COPD. Now we need to get a little more serious. Your phlegm isn't coming from your nose or throat, but from deep in your chest. We need to talk about COPD, chronic obstructive pulmonary disease, and chronic bronchitis. I call it the echo of the past because the main culprit is usually tobacco. Even if you quit smoking 20 years ago, the lungs never truly forget. In this condition, the airways are permanently inflamed and the mucus-producing glands overwork. It's the typical smoker's cough in the morning. Here's the telltale sign. Unlike the white or clear phlegm of allergies or reflux, the phlegm here is usually thick and yellow or green. If you ever smoked and you have chronic bronchitis accompanied by shortness of breath, don't delay. See a doctor immediately. Early diagnosis is key to protecting the lung capacity you still have. Because number 3, forgotten dryness, dehydration. This is the simplest cause, but ironically the most overlooked in older people. Remember this rule of physics. Mucus is 90% water. When your body is well hydrated, mucus is fluid and moves easily. But when you're dehydrated, your body survives by drawing water from everywhere to nourish vital organs. As a result, the layer of mucus protecting your throat runs out of water and becomes a thick cement-like glue. It gets stuck, not because there is more of it, but because it's too thick to move. Why do older people fall into this trap? Because our thirst sensor ages and we simply don't feel thirsty anymore. Add to that the modern moisture thieves, heating in winter and air conditioning in summer. Both squeeze moisture from the air and from your own mucous membranes. Check it right now. If your urine is dark yellow, phlegm isn't an illness. It's the cry for help from a body that's starved of water. Cause number 4, the invisible flow postnasal drip. Imagine there's a leaky faucet in your throat. It doesn't gush, just drips. Tick, tap, drop by drop, 24 hours a day. That's postnasal drip. Unlike a noisy cold that clogs your nose, this enemy works in the shadows. You can breathe perfectly well, and your nose may even feel dry. But behind the scenes, a constant stream of mucus trickles down, irritating your throat and creating that permanent need to clear your throat and spit. Who's the culprit? Allergies. And don't just think of spring pollen. I'm talking about the enemies inside your own bedroom, dust mites, air conditioner fumes, or your beloved cat's fur. Sometimes you don't even need an allergy. Sudden change in temperature, dry air, or a strong perfume is enough to trigger your nose to open the floodgates. If your phlegm is accompanied by sneezing or nasal itching, it's very likely that this invisible tap is the cause. Cause number 5. The traitor in the medicine cabinet side effects. Finally, check your medicine cabinet. Sometimes the culprit is precisely the friend that's helping us treat another illness. As older people, we take many medications, and some drugs have coughing and phlegm as a classic side effect. The most typical example is blood pressure medications from the angiotensin-converting enzyme ACE inhibitor group, whose names end in asterisk, asterisk, pril, asterisk, such as enalapril and lisinopril. They are lifesavers for hypertension, but in some people they cause a persistent, dry, irritating cough, creating a false sensation of phlegm. Or older antihistamines dry out the nose, but at the same time they dry out throat secretions, turning phlegm into sticky clumps. My advice is to become the detective of your own health. If the cough and phlegm started right after changing or starting a new medication, don't stop the treatment on your own. Absolutely not. Instead, take the prescription to your doctor and ask, "Doctor, could this medication be the cause?" The good news is that modern medicine always has excellent alternatives that don't produce these annoying side effects. We've already exposed the enemies. We now understand why phlegm clings to you. Now let go of resignation. It's time to fight back. I'm not talking about temporary fixes or pills that only treat the symptoms. I'm giving you a comprehensive method that attacks the problem at its root to eliminate phlegm once and for all. This is our 4-step plan. Asterisk, asterisk. Step 1. Thermal hydration strategy, the secret weapon. Asterisk, asterisk. The first step, the simplest and also the most powerful, is water. But not just any kind of water will do. We need a strategy. My rule of thumb is this. Take your weight in pounds and multiply it by 35 milliliters asterisk, asterisk. That's the exact amount of water your body needs each day to function optimally. However, the secret lies in the temperature. Cold water constricts blood vessels and hardens mucus. Warm water, on the other hand, is the perfect solvent to melt phlegm and soothe irritated airways. Make warm drinks your throat's best friend with this plan. In the morning, start with a glass of warm water with lemon to alkalize the body. Mid-morning, herbal teas are medicine. Ginger tea is the most powerful natural anti-inflammatory. Thyme tea is an excellent expectorant that helps expel mucus. Peppermint tea contains natural menthol that opens the airways. At night, drink chamomile tea with honey to calm the nervous system and coat the throat with a soft protective layer. Set a goal. Every few hours, a cup of hot beverage should enter your body. This small change will bring surprisingly big results. Asterisk, asterisk. Step 2. Control your environment. Create your own oasis. Asterisk, asterisk. You can drink liters of water, but if the air you breathe is as dry as the Sahara Desert, this battle will be very difficult. Remember, your lungs need moisture. Your mission is to control the environment where you sleep. The ideal humidity should be between 40% and 50% asterisk. Asterisk. The ultimate weapon is a cool mist humidifier. Place it in the bedroom, and you'll notice that you wake up with a much clearer nose. Important note. Clean the device regularly. Don't allow it to become a breeding ground for germs. Home remedies can also help. If you don't have a humidifier, no problem. Steam in the bathroom is a great alternative. Before going to sleep, turn on the shower with hot water, close the door, and breathe in the steam for 10 to 15 minutes. You can also try steam inhalation with a bowl. Place boiling water in a bowl, cover your head with a towel, and carefully inhale the hot steam deeply. To loosen phlegm from the bottom of your sinuses, another simple trick is a damp towel. Hanging a damp towel in the bedroom can noticeably improve the humidity in the room. Asterisk, asterisk. Step 3. Active cleansing techniques. Asterisk, asterisk. Now that the environment is suitable and hydration is sufficient, we need direct techniques to sweep the debris out. Saltwater gargle is one of the simplest yet most effective methods. Don't underestimate this old remedy. Science shows that salt creates osmotic pressure, which draws fluid from inflamed tissues and helps flush out phlegm. The formula is simple. 1 or 2 teaspoons of salt and a glass of warm water. Gargle deeply for 30 to 60 seconds, 3 times daily. Pure honey also works like a liquid shield. Taking a teaspoon before bed, coats the throat mucosa with a protective layer, reduces irritation, and effectively stops nighttime coughing. Another powerful method is nasal washing, also called nasal irrigation. If you suspect postnasal drip, this technique can be a true game changer. Use a neti pot or a nasal wash device to thoroughly clean your nasal passages. However, there is a vital warning: never use tap water. Always use distilled water or boiled and cooled water to avoid dangerous brain infections caused by amoebas. Step 4 is attacking the root of the problem. Finally, we don't just treat the symptoms. We must eliminate the cause. If the culprit is silent reflux LPR, gravity becomes your ally. Elevate the head of your bed by 15 to 20 centimeters. It's important to elevate the legs of the bed, not just stack pillows, because pillows can cause neck pain and don't solve the reflux problem. Gravity will help keep acid in your stomach while you sleep. Follow the 3-hour rule. Do not eat anything for 3 hours before bedtime. An empty stomach means there is nothing that can reflux upward. Should also eliminate irritants from your diet. Say goodbye to spicy foods, fried foods, chocolate, coffee, and alcohol. It's also wise to avoid tomatoes, which are too acidic for an already irritated throat. If allergies and postnasal drip are the culprits, your bedroom must become an allergen-free zone. Use dust mite-proof bedding and wash sheets and pillowcases in hot water every week. If you love dogs and cats, that's understandable, but try not to let them sleep in the bedroom. Pet hair attracts dust and allergens. Consider investing in an air purifier with an HEPA filter. It can remove tiny airborne particles that are invisible to the naked eye. When you combine these 4 steps: drinking warm beverages, humidifying the air, cleansing the throat and nose, and eliminating the underlying cause, you are not simply reducing phlegm. You are rebuilding a healthier, stronger, and clearer respiratory system. Don't expect instant miracles, but start applying these 4 steps today. However, as a physician, I have a responsibility to say this clearly. Don't be reckless. The knowledge shared today is a powerful support tool, but it does not replace a direct medical evaluation from a healthcare professional. Listen carefully to your body. If you notice any of the following signs, stop watching and consult a doctor immediately. If the phlegm persists for more than a month despite trying everything, it needs medical attention. Another warning sign is the presence of blood in the phlegm, even if it is just a small pink streak. Phlegm that becomes dark green, brown, or bright yellow, and is accompanied by a high fever can indicate a serious bacterial infection. Pay attention to breathing problems. If you feel short of breath, experience chest tightness, wheezing, or difficulty breathing, you should seek medical help immediately. Your overall condition also matters. It's unexplained weight loss, extreme fatigue, or bluish lips and nails are serious warning signs and may indicate a medical emergency. My goal is to help you become proactive with your health, not to encourage self-diagnosis of serious illnesses. Modern medicine should always be used when necessary. Today we've learned an important lesson. Phlegm is not an inevitable burden of old age. Here's a messenger signaling that something in the body is out of balance. The good news is that you have the power to restore that balance. We have unmasked the silent culprits and equipped you with a practical set of tools, from drinking a simple glass of warm water in the morning to controlling the environment where you sleep. Do not resign yourself to living with that annoying feeling any longer. You have the right to enjoy a clear throat. You have the right to speak freely without constant interruptions. But knowledge alone is only potential. Action is true power. So I ask you to do 2 small things right now if this video has helped you. First, share it.
One simple share could help a friend or family member finally free themselves from a discomfort they may have suffered with for years.
Second, subscribe to the channel and turn on notifications so we can stay connected.
I have much more valuable health knowledge to share with you. And finally, leave a comment below with one simple word: asterisk, asterisk, action. Asterisk, asterisk, then write the first step you will take today. Today, for example, asterisk, asterisk, action. Drink warm water, asterisk, asterisk, or asterisk, asterisk, action. Elevate my bed. Asterisk, asterisk, reading. Asterisk, your commitment is my greatest motivation. Thank you for your trust and for giving me your valuable time.